Hello all, my name is Dina. I'm a Track 2 intern, and today I will be presenting my outcome study on evaluating a nutrition education tool, Nourished, in a food pantry setting. So before I started my community nutrition rotation at the Blue Ridge Area Food Bank, I received an email from my preceptor asking me if she could throw me into the deep end on day 2 of my rotation to assist with data collection for a pilot study that they were running. I was happy to accept this challenge, and after further discussions with my primary preceptor, we decided that my involvement with the study would align nicely with the requirements for this outcome study, and I'm excited to share it with you all today. So I chose to focus my literature review on this cycle of food insecurity and chronic disease. So the cycle begins with food insecurity, which the USDA defines as the lack of access to enough food for an active, healthy life. And unfortunately, over 37 million Americans in the United States fall into this food insecure category. And the status of food insecurity can lead to negative coping strategies such as a decrease in dietary quality, a decrease in eating behaviors, and a decrease in bandwidth or the energy or mental capacity to handle a situation, and the situation being food insecurity. So these negative coping strategies in turn can lead to chronic disease, which can in turn lead to a decrease in employability, an increase in healthcare expenditures that creates an environment where there's spending trade-offs, and an overall decrease in household income that further fuels food insecurity. So this is a vicious cycle that many people suffer with. And several studies have shown that people who visit food pantries experience this double burden of food insecurity and chronic disease. And recent data indicates that more than half of food pantry clients have a household member with hypertension, and 1/3 have a member with diabetes, which we know are affected by diet. So opportunity definitely exists in pantries for to promote, better nutrition for the communities that they serve. And the Blue Ridge Area Food Bank has sought to do so with this pilot study, which is pilot testing a nutrition education tool known as Nourished. So Nourished was developed by my primary preceptor, Dr. Michelle Hess. She's a dietitian and the director of the Blue Ridge Area Food Bank. And her and a team at JMU created this tool. So Nourished does have an online platform that utilizes an algorithm to categorize food items into a stoplight hierarchy based on nutrient density. So as you can see in figure 2, this explains Nourished. And so green items being those that are the most nutritious, most nutrient dense that we should be having often, yellow being those that are nutritious but might have more added salt, fat, and sugar and should be only had sometimes, and then these red items that are the least nutritious that we would want to limit in our diet to rarely. So what food pantries participating in this study can do is they can utilize this online platform to check the food within their pantries for which category they fall into and arrange them on their shelves within the pantry with appropriate signage for clients to see, to assist clients in making food choices with nutrition in mind and making healthy choices the easy choice. So the success of this tool was not assessed prior to this study. And the purpose of this outcome study is to evaluate the implementation of Nourished in a food pantry setting. And the objective is to gather feedback from the pantry clients to determine if Nourished is impacting their choices as it was intended to do. So moving on to the methodology of this study. So this study utilized a convenient sample of food pantry participants from local food pantries within the Blue Ridge Area Food Bank network. Central, Marquis, and Verona were the 3 pantries, and these 3 pantries were chosen specifically because they exhibited a choice model, meaning that clients can go in and choose food like they would at a grocery store rather than just going to a pantry and picking up a box or a bag of food. And this was needed because we need this choice aspect in order to assess whether this Nourished education tool can impact client food choices while they're at the pantry. So also, this study was conducted during the early stages of Nourished implementation. So Nourished had only been present in the pantries a couple months prior to us coming in and collecting this data. And the reason for us entering in to collect data early on in Nourished implementation is the part of this rapid cycle improvement method that involves this plan, do, study, act cycle. So like with any other study, you have a plan with a set of goals, you set out to accomplish those goals, you study, but this act section involves identifying if there's areas for improvement, changes that need to be made, and making those changes very quickly, acting upon it, and then repeating the cycle. And this creates for a better quality of data collected. So moving on to the actual data that we collected, so myself and 2 to 3 members of the Blue Ridge Area Food Bank staff visited each of the participating pilot food pantries to collect data. And we collected data through interviews with clients and volunteers using a list of guided questions. And the plan was to utilize transcripts from the interviews to do a themes analysis. And figure 4 shows the questions that we asked each of the clients. So as you can see in the results section, we were able to capture 36 total client interviews. And the initial plan was to utilize the transcripts from these interviews for a themes analysis. But the initial client feedback questions were really not that successful in capturing sufficient transcripts for a proper themes analysis. Because when we were asking clients, have you heard about Nourished at the pantry? Majority of them hadn't even noticed the signage or hadn't noticed it at their respective pantry before we came in to do the data collection. So as you can see in figure 6, 78% of all the clients that we interviewed had not initially noticed food Nourished at their food pantry. So they were unable to really answer sufficiently to the remaining questions on the questionnaire, which were kind of designed assuming that clients were choosing, noticing Nourished at least, and choosing whether or not to use it while they were at the food pantry. So as part of the Plan, Do, Study, Act method, we made changes to the questionnaire, the questions that we were asking clients. And we also had a plan for if they said no, we would explain Nourished to them, and then we would have some exit questions to ask them as they were leaving the pantry to see if they did notice Nourished after we explained it to them. And then if they said yes, we had a plan in place as well, and exit questions for them as well. So this revision did help us to gain more sufficient transcripts from the clients that we can use to analyze at a later date. Another reason, aside from the issue with the questionnaire, as to why we might have not been able to gather sufficient transcripts from clients when we first visited the Marquee and Central locations, was because we were attempting to interview clients right before they went up to do their intake. So the time that we spent with them was very brief. Whereas with this revised interview questions, and then also a different method where we got to kind of meet with them right before they did their intake and then after they were done shopping, that provided us with 2 times to talk to the client and have a greater interaction with them than just while they were waiting to do their intake. So as you can see, so we implemented this change right before visiting the Verona Food Pantry. And as you can see in figure 8, after we introduced Nourished to them, after they said, no, I haven't seen it, and we asked them this exit question if they noticed it while they shopped, 83% of the clients did notice Nourished. But as you can see in figure 9, that didn't necessarily mean that they would use the tool even though that they noticed it. As you can see, there's varying results here. Volunteers were interviewed during this time, but data collected by them wasn't analyzed for the purpose of the study, but did provide some helpful insight along with observations as to why Nourished might not be successful at this time. One reason being that the food items placed on the shelves at the pantry might not be in the correct yellow, green, or red category, which can take away the credibility of Nourished. Also, there's been some issues with the visibility of the symbols on the shelves, as well as the half sheets and the signs that explain Nourished. Other factors that can play a role as to the success of Nourished at this time is that as a volunteer had, stated, clients are trying to just grab and go the food at the pantry. They're embarrassed to be here to begin with. They aren't taking the time to slow down with their choices. So there could be a stigma attached to going to the food pantry that creates this environment where they feel rushed and they might not notice a tool such as Nourished that's meant to assist them with their choices for nutrition. So in conclusion, Nourished is really not having a significant impact on the food choices of clients at this time, for the reason that one, clients aren't noticing the signage, the symbols, the half sheets, the posters that explain Nourished. So there's opportunities to improve the visibility of it at the pantry, potentially by taking also a more engaged approach to educating clients about Nourished can be beneficial to them noticing the symbols and deciding whether or not they want to use it while they're at the pantry. But as we know, clients at the food pantry can fall into this cycle of food insecurity and chronic disease, and they might have, obviously more on their minds when they go to the food pantry other than nutrition. So they may not, nutrition might not be the top priority for them at this time or ever. Through this study, the Plan, Do, Study, Act method was effective in identifying, areas for improvement as we collected data, and did help enrich the quality of data that we did collect. So continuing to use this method to approach improvements with Nourished will be beneficial in the future. And this method can be used in other settings as well. In a way, I feel as though dietitians use this method to some degree within the nutrition care process, as things can change quickly in a patient or client that requires adapting and making rapid changes to ensure quality of care. And the Plan, Do, Study, Act method is an ongoing cycle, much like the nutrition care process. So the next step for Nourished is to make changes to the signage, such as moving the symbols potentially closer to the signs that tell clients how many food items they can take per household, as we observed that was something that clients were noticing, focusing on primarily. Additionally, steps to ensure that the volunteers are well trained in the pantry to ensure that the food items are not only in the correct categories, but that the volunteers can also engage more with the clients regarding the Nourished educational tool to help them notice it and potentially use it while they go to the pantry. And then lastly, further data was planned to be collected in this study, but due to the COVID-19 pandemic, the research has been halted at this time. But as part of that Plan, Do, Study, Act method, and that kind of way of looking to make improvements, we will adapt and move on.